Good evening, everybody. Welcome to Taylor Tuesday. I'm flying solo tonight. Dr. King is unable to join us tonight, so I am handling this on my own, and I'm very thankful to welcome Michael Johnson. We'll talk a little bit about Michael afterwards. We are going to be talking about looking at an approved program as an alternative to opioids. I think we've all had issues in our practices with patients, and obviously everything has been going on with opioid abuse and things that are going on. So having alternatives to be able to treat our patients is critical. But before we get started with that, I'm going to talk a little bit about Taylor Medical. You know, we've been doing these webinars since a little before COVID. It's what we've been trying to do here is build a family and build a culture. Taylor Medical was developed by podiatrists, envisioned by podiatrists, and has been run by podiatrists who are leaders in our profession. Our goal is not just to give you the best widget, but it's to teach you how to do things in your practice better than you might be doing them, or add some additional features to your practice to help get you better outcomes, i.e. why we're having a discussion today with Michael. But I will tell you that every webinar that we do is archived on the Taylor Medical website. If you go to the upper right-hand corner and you click on the webinar link, you will find it on our website. And for those of you who don't know the website, it is www.taylormedical.com. So upper right-hand corner, all the webinars are archived. They're here for you to look at. As far as Taylor Medical, I'd like to say that you should contact us for anything that you're doing in your practice. Whether it be an injectable, whether it be gauze, whether you need an x-ray machine, whether you need an ultrasound, whether you're looking for bracing, copy paper, I think that we can handle everything. We do free cost analyses for you. You can submit your information. It would be best if your company allows you to do a download with an Excel spreadsheet, where you have the vendor, the description, the manufacturer, the unit of measure. It helps us get an apples to apples comparison. Sometimes gauze is 2-ply versus 4-ply, and X amount of 100 gauze in one pack or 50 in another. We need to know exactly how we can compare it. You should email that information to admin@taylormedical.com or visit our website at taylormedical.com to find out complimentary medical supply cost analysis. And either Carla or Ashley or Jim or Siobhan are going to be more than happy to get back with you and let you know what the potential savings are. I'm going to tell you that I've had very few practices. I used to say that I had no practices, but I now have had a few practices where we've not been able to show the savings that I would like to see. But ultimately, we're here for you, the customer, for you, your practice, and most importantly, for your patients, so that you have the best items available to treat your patients. With that, I want to tell you a little bit about our guest tonight. Tonight we have Michael Johnson with MedEcho. Michael has been in the medical space for over 12 years with an expertise in protocol development utilizing wellness products to simplify the offering of products at a medical level that reduces clinic and staff disruption. Michael's company is MedEcho, and they have CBD-derived products for healthcare. The goal is, as we talked earlier, increasing patient adoption, rate of efficiency, better outcomes, and providing alternatives. Michael has worked on projects that have ranged from general wellness, nutrition, weight loss, and now pain, sleep, and stress management, with the goal to provide new approaches to safe and natural alternatives for our patients. Without any further ado, Michael, I'm going to turn it over to you. I will come back when you're finished talking and moderate any questions that we have.
Thanks, Doc. I do appreciate the intro. And now, before I know there's a lot of individuals on these presentations that have worked with Taylor Medical, but also at the same time, you've probably worked or have offered or looked at or maybe even shoved off the options of looking at CBD. I really want to start off this way, as our company is on the forefront of breaking down all the barriers of really what goes around the thought process behind how CBD would use. But what we're bringing to the table is actually a whole new approach. And I want to kind of go into what we're doing and how to simplify all of this for each and every medical practice to really provide more safe and natural options to patients. Because first and foremost, the demand for this is through the roof. We do have patients that are looking for this on a daily basis. And essentially, if they don't get it at the medical practice, they are going into the wild, wild west. I really want to show you how we have broken down all these barriers, the benefits behind these protocols, and what we have done to really improve outcomes by utilizing not just hemp. And hemp CBD is not a standalone product. So I'm going to show you how we're doing that, because just having hemp CBD in some type of oiled fashion, which is kind of the idea of how this comes about or how it's utilized, is actually not the best way to administer it, especially through the process of addressing some major categories, which we're going to talk about. So before you kind of go, look, I've already looked at CBD, it's not for us. I really want you to open your mind on what we're doing and how we're changing it, and how our companies have done this for years on nutritional products to really change the game and improve outcomes. And that's the objective in the end. So with that said, there are massive current challenges in the market. A lot of it comes around the hemp CBD understanding is that people are utilizing it, they're hearing about it. And the biggest thing is that there is no education, there's no real guidance, there's really no direction of why I would use it, how I'd use it, and so forth. And the one thing that people are finding out is those that do all the research and the study and dig into it, right, is a small percentage of that population that stay healthy, live healthy. They believe they could do it on their own, or they have the knowledge to do it on their own. They're finding it as a great remedy and extremely effective over traditional medications in specific categories of addressing some medical concerns like pain and things like that. So we want to address is that there are responses coming back from patients that are finding a huge effectiveness with this. And that's kind of spurring into the internet. And as we all know in the medical field, what you learn from the internet, of course, is not always the right information. So that leads into misunderstandings, misguided trust, right? And effectiveness of how to use the products. That's where I truly believe this becomes a great platform for medical offices to look at, then figure out how to simplify. And the positive response behind this has been tremendous. There is an effectiveness to this. And it's really interesting when you start to look at, like, let's take pain medications. They're really starting to look at, users and patients are looking at this as there is a way that I don't have to do like opioids or certain pain medications. CBD could be an option for me. So there are people looking at this, and we have to take a really diligent look at what they're using it for, how they're using it, and how we could, again, simplify that process for people. And one of the biggest topic of reporting is that it provided the best medical relief. And then you get into it, it relaxed me. And I was really, my response is that I just didn't want it to get me high. And this is a lot of individuals. That's where we get into cannabis and marijuana CBD, which is a whole nother realm and a whole nother species of plant. So we want to talk about hemp CBD and how that's helping. And most importantly, it gets into is that they want something that's not going to cause anxiety and paranoia, which all comes with the toxication effects, which we're going to break that barrier down tonight too. So this is where it's growing and tremendously. And I'm almost going to argue that the new studies that will come out is that stress will trump over pain and sleep. With everything that's going on with the pandemic and lockdowns, that will end up becoming to the forefront. So we are seeing all kinds of different ways how users are not only using it, but now how physicians are coming to the table going, how can I help my patients further? And they are falling within these categories. So we're going to focus on these categories first to make it simple, why people use it. The next thing is also lack of guidance and education, like I talked about. There is zero education and guidance on really what CBD can do in regards to if you do it and apply it the correct way, and what you can actually take with CBD. Meaning is that, we would probably kind of have the argument about multivitamins all day as a standalone, but there's a lot of, there's a lot of research and studies that comes about adding omega-3s and vitamin Ds with Ks, and right. So we're talking about supplementation and adding it as a complete package. That is part of that education and guidance. And then most importantly becomes the deceptive product manufacturing. We are continually finding out that a large amount of CBD products are mislabeled. The CDC is, the FDA has even come out on studies showing that CBD products and labels are heavily misguided in two major categories. One, the CBD itself, right? So we're seeing there's X amount of CBD in a vial or in the product that you're giving, but it's actually not. So if it says 1,000 milligrams, by the time you actually probably run a test on it, it's probably only 700 to 800, and that's what's coming up in the studies. So the levels are lower than what the actual labels are stating. The next is the THC, and this is where it becomes a credibility issue, right? So from our standpoints as healthcare professionals, I want to offer something to my patients that they could trust. I want something that's going to keep my credibility intact with them because I want to offer them something that's going to help them. And then third is, am I giving them something legal? That is the biggest concern. Now, hemp and marijuana are completely different aspects. 2018 is when the Farm Bill came to play, and that looked at, okay, well, hemp is more of an industrial product, right? So we use it for all different types of industrial uses, like rope and things like that. And the extraction from that has the same properties in the cannabinoids that cannabis does, but of course, without the risks of THC. So that's hence why hemp has been extracted out. So there's a couple things in the United States we have to figure out to keep and conform to, not alone. I mean, when I mean figure out is when we go into manufacturing, and things we have to display to both our users and of course now at the medical level to our physicians. And that comes down to THC and CBD. And the THC levels are where the biggest concern comes. Because if the levels are not what they say, the regulations are 0.3% by volume, it's illegal. So if they're not measuring that and certifying that, especially for users, and most importantly for your offices, there could be a violation of federal law. That's where the biggest concern comes into. And they actually found out through some of that testing that the FDA did, they found levels above the 0.3%. So those are the concerns that we have, is that how do we provide this type of trust? And then you don't get it from some cottage industry because there's thousands and thousands of products. Doc and I were just talking about it. There's a million products that have come to the table over the years. A lot of them are cottage industry. So how do we resolve that? How do we create trust at so many levels? Of course, in the manufacturing process. So we're going to look at that too. Okay. And then, as you know, these days, adding cash revenue is paramount to clinic success. Everything we're going to talk about is cash day of service, but also simplifying it so it doesn't add more work to the practice. That's the key. We don't want you to have to do more work or feel like this is going to disrupt your staff, take away their current duties, and really turn it into more of a burden for really what you get out of it. So risk versus reward. So we're going to look at that too. And then, of course, vendor on sale efforts. And this is one of these things I am going to 100% sit here and give you a promise to, is that our company, because we have been in the medical space and we have worked with thousands of medical offices over the years, I put pride in protecting our medical offices. We are not a company that goes, look, I'd love for you to carry us in-house, offer our products to your patients. And then once they leave your door, I'm going to figure out some way to market to them with a coupon. That is not our business. That is poor business in my opinion. And that leads to loss of patients and loss of revenue. And again, undercutting. That is not who we are. We are putting our foot forward in protecting our medical partners by saying, if you have a patient that starts within your office, they buy product, we already know by what is already happening in market and virtual sessions and making it easier for patients, they're going to ask for a refill option to have this sent to their home. And we have a solution for you, and it doesn't cost you any money to manage it and run it and getting boxes and shipping things to people's house. That is not something we want to add on to the burden of the clinic either. So we have that covered for you too. And that's without going to some outsourced system where there's like some rebate that you get that is so minuscule to the effort, it's not worth it either. So we're going to talk about all of that. So the solution with all of this is what our company and I mean medical teams we're going to talk about too, is that we come together to create something that's very simple for us to finally offer safe and natural condition-specific options to patients in structured protocols without removing the physician oversight, which is one of the most important things that come to play when we're talking about obviously maximizing outcomes. So that is the solution of who we believe we want to portray to you as a company, and we want to stick behind to really provide great solutions and improve outcomes with you. So we are the first to healthcare to be recognized in a certain amount of ways. And we say recognized by our medical teams and the physicians we've already worked with by providing you very clear guidance and structured programs on offering these items, these products, these formulas to patients under the categories of pain, sleep, and stress. We only supply licensed healthcare professionals. We don't sell to like some hairdresser, or actually we don't even put products on a shelf at a pharmacy. We just don't do it. We believe the touch of a physician is still the most important to get compliance and improve efficacy. And then we're working with obviously clinically validated key ingredients and THC level assurance certificates, CBD certificates. We're going to show you how we do that. And what we have a program called Online Protection for Profits. So all of this combined into one program. So the protocols, we're going to talk about programs. I don't want to talk about products. I want to really talk about what our efforts are and giving a clear direction both on why you would offer this, making it simple to do it, quick, and most importantly, giving purpose to an actual patient to understand why they're doing it, how they're going to get there, and then taking away all the question marks on what they're going to need to do to have that happen. That's exactly what we specialize in, is creating these medical programs to make it very simple for you to offer and patients to follow. So these categories, right? It doesn't matter where it might lie and how you might use it. That's why we're looking at categories that keep it simple in pain, sleep, and stress. And then I'm going to show you how that can then merge out to where you think it's best and how you would use it within those programs to make it still simple for where you might focus, like arthritis and anxiety and depression, or pain, tissue recoveries, physical rehab recoveries, post-ops. And even we have GYNs we're working with at very large groups already on how they can administer this for female responses, from menstrual to you name it. So it's amazing where providers are taking this once we've simplified the process. So these are the standard, what we call base programs, where it starts. We have pain, we have sleep, and we have stress. And these are the actual protocols. They're 5x5 brochures. They act as actually a review for a patient to understand what we're doing, but it also acts as the actual protocol itself. So within these categories, and each one of these have simple steps. Everything is laid out to go, okay, great, I'm stressed and I'm going to utilize this. How in the world will this, one, help me? Two, how do I even get started? So it starts with where we want to, always to begin. What's your assessment? And then from there, we simplified it for you to just basically say, great, if they're in this assessment, this is the products they would pick and use. Then to combine that, we're going to give them an actual video and support education to have them understand how to take it, when to take it, and it's in a simple 3-minute training. So we've got this all the way down to just simplified. Then from there, as a physician, you can decide to add coping mechanisms, which is going to be a big part to some of these programs. So like sleep, taking supplements and such before bedtime or whatever the program is going to facilitate out, doesn't just work as a standalone, because if you're drinking a lot of alcohol before you go to bed, or you don't have other activities you're adding to your life to reduce stress, or whatever it might be to improve that actual sleep, it's never going to happen. So still, we understand it's not the product by itself that actually that fortifies it. It's everything that comes along with the programs, which is what we need to tell the patients. This is what these programs do for you. And this is how we make it easy for you too. Now, those programs have also expanded and even more simplified. So I'm going to kind of give you an example of what we've been doing to make this even more easily dumbed down to where it's just grab, go, follow instructions, and start. So we have, like in pain, we have even more structured down programs like physical rehab kits and even sport recovery kits that athletes are using. So if you feel like you're more in the realm of you have a lot of athletes and you're in that segment, we have kits specifically designed for them. It's all laid out, instructions, products, how to use them. It's all in training. It's basically, look, we want you to take this. This is our outcomes. Here's the box, follow the instructions. And the goal is to keep it simple at the clinical level. So these are options that your business could expand into and what we're doing to make it simple. Now, with the products, we have taken a massive commitment to a couple things, making sure that we provide medical grade products to all of our physician partners. They're non-intoxicating, they've been tested for toxicity, and they're non-addictive. Especially with the pain effort, we're looking at how do we make this a great thing of not only addressing pain, but not bandaging it. A lot of the CBD companies that are coming out are, I'm going to put an X amount of CBD in there, but I'm going to load it up with menthol just to mask it so it looks like we're getting an outcome. And we all know in about an hour or so that menthol is going to wear off and they're not going to get anything from it. Then they're going to use more and more and more. And before you know it, a vial that technically should have lasted them 30 to 45 days, they blew through it in a week. And now they're upset because they spent all that money on it. And they realistically didn't get an outcome. That is essentially what the feedback has been back from actual patient results and their surveys back to us. This is why they have been so committed to purchasing our products and utilizing them in what they're hearing. So safe and natural is the biggest thing. There are two different types. We have a very low line of products because we made them very specific to the programs. There's no reason to carry a lot of stuff because we got it all the way down to what's really needed to provide the outcome. So within the oral offerings, we do have drops and we have capsules and chewables because patients just have different ways of how they want to consume the actual oral. But the sublinguals are the best. Doing drops and holding them has the best way to enter the system without the capsules and chewables going to the digestive system. So we do give options across the board on how they could take it. Now, the topical offerings and things like sprays, we're the first of the market that actually utilize condition-specific formulas with CBD. Example, like sleep solution, we're combining with melatonins and GABA and valerian roots because the melatonin might get you to go to sleep and the CBD creates the relaxation, but the GABA and the valerian root is going to get the long-term sleep activation. Plus, we know that it's not just the CBD and standalone. We're going to need an X amount during the day. So there's actually two products just like supplements that are in the kit. Also, because we put sleep solution on the bottle, we had to make sure we are following the FDA guidelines because we are manufactured in FDA facilities. So we had to make sure that our variances of percentage of these formulas are not only the best suited for the best outcome for the patient, but they're also in compliance to making it condition specific on the bottles. So it says sleep solution. The pain creams will say pain cream. We have worked diligently with our medical teams to ensure we can make it very condition specific. So it even says it on a bottle, what they're using it for. We're one of the only companies in the entire market doing this. So with the product line, they are all combined in these programs. You don't have to remember which ones to do and how to combine them. We do that for you. So it even simplify it even further. Now, patient potency assurance. As I said in the beginning, one of the biggest concerns is THC level and purity of CBD. We come to the table with a 5-time certification process. Not only do we test the oils for toxification, but once they go through manufacturing, we test them again. And through that testing process, we actually verify and guarantee the CBD purity and potency. So if we're saying it's 1,000, it's within a 5% swing. If the THC is, we are verifying it and guaranteeing it's at 0.3% or less. Some of our products are actually at 0.0025%. They're so low that you're not going to have to worry about tox screening. But most importantly, you're giving a guarantee to the actual consumer or your patient, so they don't have to worry about this stuff. We want them to have peace of mind. Most importantly, we want you to have peace of mind. So we know exactly what we're giving our patients when they actually decide to take these programs on. Okay. And then we look at it as trusted manufacturing to you. All our facilities are FDA certified facilities. They're OTC certified facilities and GMP. We source hemp in the United States from organic sources only, and all hemp sources, which we can verify to ensure we're within the federal regulations. Again, we do all this so you don't have to worry about it. We don't want you worried and stressed about, am I giving something that I shouldn't be giving? Is my patient going to get something that they shouldn't be getting? This is exactly how we do that. And then this is where we want to take that stress off your shoulders. We've done it all the work. We just provide you the certificates. And this is available online and at any time that you need it. And it's by batch number 2. So everything we've done is clinically tested. It's full medical grade. It's all FDA certified facilities, as I said. And what's great is over the last 2 years, some of you might know us as Hilltop a little bit previously. Actually, the formulas are what made it. That is exactly what we did. Was we did 2 years of testing and ground testing and looked at thousands of different combinations. And our medical team said, look, these are the best ways we're going to get the best result. That is what we're providing to you. Okay. So these are our promises to you, as we said before. Licensed healthcare professionals only. We're never going to compete against you. We guarantee price neutrality, meaning is that what we're providing to you and the purity of the potency, how long it's going to last, how much they're going to use, and the outcome they're going to attain, that price is going to match the market if they went off on their own. That doesn't include all the oversight and the education and the programs we're going to give them. So we're not providing this at a maximum fee. That's not right to a patient. We don't want to do that to them. But most importantly, because we're the manufacturer, we're able to get these prices at an outstanding level for you as a wholesale. So your markup is about where you would make unusual supplements, or if not more. So we've been proven to that price neutrality and committed to it. And then we have very simple step-by-step launches. How to get started with us is about as easy as it gets, and we'll go through that too. So we want to look at, of course, improving the patient retention. Now, our medical teams. We have hired board certified physicians. Our medical team right is comprised of right now an oncologist out of San Francisco, Dr. Thomas. You can read about her on our website. All the members you can read about on our website. And Dr. Tracy Thomas is out of San Francisco. She's an amazing oncologist, actually in sports therapy. Our cardiologist, we have a triple board cardiologist who's also board certified in sleep and in actually obesity and nutrition. He's been working with us diligently. He's out of Arizona, Dr. Rothrock. And then we have Dr. Sherman, who's a GYN with Axia Health. We've really gone to the higher levels to find unbelievable physicians to figure out all different types of modalities, ways it could be used in different settings in different patients. Each and every one of them have been very dedicated to write these programs, continue to look at improvements on our products, and provide feedback to you to make sure that what you're offering is the best of the best. That's essentially what we do with our medical teams, and they're involved on a weekly basis within everything we do. Our training and support is bar none. We focus servicing through the nose. These days, I'm sure most of us go into restaurants these days and wondering where all the services has gone. We are dedicated more than ever to ensuring that you get the service you want. Fast response, fast shipping, fast everything. I don't want you waiting. We don't want our physicians worried about if they give this to a patient, if I don't have the right answer soon, they're not going to make the right decision. We want all of that taken care of in a timely manner. That's one. Two is that you have a team that you can count on. Our servicing department is all virtual. You can connect it with them at any time. And we give you a dedicated consultant. So they are the one you would call for everything that you need, including servicing, questions on products, new things that are coming out, and of course, how you can even expand your patient base and make a bigger impact. So all of it we focus upon. Okay. The tools we provide too. So this is one of our added benefits. We continue to look at ways to make it, one, non-disruptive. Two, you don't need big pop-ups in your office. We don't need all that. We just need enough to make an impact. But also, how can we use these tools to make it more simplified for you to offer it so there's a procedure behind them? So this wooden display that you see is no bigger than like 16, 17 inches. It is not that big. And it's about 7 inches deep. It's double-sided, so you could put it on a waiting room table. Every physician has put this in, has said this thing probably does 70% of the overall education to a patient. So they grab a brochure to come in and go, how do I get started on this? So the goal is, how do we eliminate a lot of the questions up front for you? Next is it actually has a sample bottle on top of it. So people are looking at doing spray that has the instant relief. They can actually test the instant relief stuff. So we have that all built in. Our signs are actual corner signs. They're not that big. They're 18 inches. They actually fold. It's called the new 3D signs. You're probably thinking every corner of your office and your patient rooms you've never used. We figure out a way to use it so it's not some big intrusive poster on your wall. So we figure out ways on that. Script pads from product bags, you name it. It comes with your setup because we want you to have all the tools that are, again, not intrusive, but it really gets the biggest bang for the impact and they're inexpensive. So we want to make sure we give you things that work with this. And we actually have ways for you to get a free kit when you get started with us anyway. So the things we are doing to work with you. So that's our marketing efforts. And then online retail profit. This is one of the most exciting parts that I think is part of our programs is our refill program. We have constructed a compliant patient portal. The patient portal is something that you control. You put them in, okay? Once you enter the patient in, we just ask for their name, their phone numbers, their emails, and then what program that they did. That goes into our systems to allow them access. It does actually two things. One, gives them a further education video so you don't have to spend any more time to them than you need. It'll train them, show them how to use the products, how to apply them correctly. It's like the missing piece from what we give to them on the products and the protocols. So it finalizes and caps it off, and it saves that time that you don't have to do it in the office. So it's all automated. From there, they receive additional education. They can get access to all their certificates of analysis on each and every product. And most importantly, they can conduct refill subscriptions. Now, refill subscriptions are what the majority of the market wants. We handle all of it. So we built all the e-commerce situations for that. We do the e-management store. We manage the whole thing. We do the upgrades. And we do the drop shipping to everybody's house. It comes in a really nice standardized white box. We don't just throw bottles into an envelope for them. They're going to get a quality actual package to their door with program cards. They're going to get the products nicely packaged, and it's going to come like a present. Our teams have worked to make sure it looks good when it shows up because we want to be a representation of you as our provider. So that is one of the biggest things we have that are part of the refill program. Most importantly, we cover the credit card processing. Now, if you don't know much about CBD credit card processing, this is where the nightmares typically start to come in. What has happened is that banks are like, we'll let you do CBD processing. But once they find out you're doing CBD processing online, your credit card processing fees could go to 4%. So they will nail you across the board if you're taking in credit cards internally and you're like, wow, we've been getting a good rate at 2%. This will shut it down. So we've taken on that burden and risk, and we've been verified for e-commerce solution processing for hemp CBD online and direct shipping. So we've gone through all that work, all that verification. Just so you know, this takes like 2 to 3 months to get verified. We've done all that for you. So you do not have to worry about risking selling stuff on a website through e-commerce, besides taking on the whole thing about drop shipping and so forth. So we've done all that for you. There is a procurement fee, but it covers all that. So if you think of it as you don't realistically pay until something sells. So it comes out of that, but that fee, if you think about it, is so minuscule to the costs that if we did it as a group, it's very low. And if you did it on your own. So those services are automatic. You do not have to take advantage of them. You could have, like, my patients love to come see me, which I'm sure they do. But you can have them come see you every month and buy their products on site. If not, this creates a little bit of a lower inventory hold for you, which is great. There's less money in the bank and then on the shelf. We manage all of it. We just ship it right about our inventory, and you don't have to pay for it. And you just make the profits from the retail, which is outstanding. So you still get the benefit of e-commerce sales. So that's part of our programs. So the decision from here is basically yours. What I always say is that there's an easy way to get started with us. We talked about the programs and such. If you are interested in doing this and you think this would be a great option for your clinic, there is not much of an obligation. You would basically reach out to me. I can do just a recap of any questions that you have. I can go through any small details, make sure you're very, very comfortable with our programs and how easily we can implement it without, of course, disrupting the clinic. Then you tell us how many kits you would like. You could easily go, I want 5 pains, and see if I could sell and utilize those. I would rather do sleep. Can I get 6 sleep, 10 sleep? Just so you know, right now from our clinical work that we're doing, and this is clinical reporting coming back, physicians are easily, if you're seeing 20 to 25 patients a day, easily minimum doing a kit a day. So you're probably already thinking 5 kits, that's a week's worth. So you could easily test very quickly. We are not you have to buy a minimum. You have to do business with us for X amount of time. I want to show you that we could improve outcomes with simplified programs. And this could be great for your clinic as an added option without, again, this creating a lot of disruption with everybody. So your decision from here is simple. I'm going to give you two options. One, of course, if you're already doing CBD, I understand that. I'd like to see if we can try to make this easier for you as an option. I'd love to review it for you further. Or you can continue to send them down to the pharmacy. Or give us an opportunity to work with you. We would love to have your business at least prove to you what we can do and how simple it is to get set up. If you feel like that's the way you want to go, it's easily, I'm going to send out an email after this where you can just book a meeting. It takes less than 30 minutes to get going. Paperwork goes out by DocuSign because we do have to do some agreements just on trademark usage. And actually, most of it's laying out what we're going to do for you. And then from there, your product ships out of what you need, and then it arrives. We ship out in 2 to 3 days. So we guarantee stuff to arrive very, very quick because we don't want you waiting. So that's the main process. Or if when you start to look at numbers, I'll go for I'll go for an or in a second here, but I want to talk to you about profits on this when you do get going. I will send this out to everybody so you have this, but this is realistic. This is, again, based on if you did a kit a day, and if you did 25 patients every day, and you did this for 25 days worth of business, and most of us are operating around 25 days of business. So you make about a $50 profit every time you sell a kit. It's about a 70% markup off the product wholesale. So you're going to bring around $1,250 off that business per month. But what's exciting is that the refills. So what you do on site is what you do. Once they're started and you put them in the portals and they have refill options, we're actually finding out patients do refill subscriptions on pain up to 2 to 3 months. Sleep, it just keeps on going. And most people that use it for stress or inflammation purposes, we've had customers that have been ordering from physicians for almost a year. So we really strive on not only the customer service, but they're getting quality products. And that's why they keep coming back. So if you figure all of that in, we're seeing physicians range anywhere from $25,000 to $35,000 in additional revenue after product costs per year. So you have 2 physicians. This could be a very profitable ancillary addition to your practice without, again, not a lot of disruption, because that's our goal. So this becomes one of those options for your practice and easily installed. So this will also be sent out in the email after the webinar. Okay. And then offering with us. This is how you essentially get started. We do a quick call. We're going to send you out vendor paperwork. It's click, 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 and done. You're going to receive your initial order of what you want. The marketing kit, you do an hour training. You could actually break it up into 2 sessions so it conforms to your time schedules. I know stuff is crazy, or you can have the office manager do it, but the trainings are very quick. How to speak to patients, how to offer the programs, how to set up your kits, how to get on your portal, because you're going to get a portal too, and how you can order in the future. There are lockdown portals that are specific to you and all the education that's on there. And any other questions you might have there, we could answer in CBD, things you want to get more versed on. What's great about the 1 hour training, it covers everything and very simplified. But then from there, if you want some CE, we can continue to give you education in any kind of sorts that you feel is necessary to improve your knowledge on CBD and offering it to patients as you grow. Okay. And that's it. And you start offering programs to patients. Typically, I've gotten physicians up and running in about 10 days. So we can do this pretty quick. So simple initial orders. You just tell us what you need. As I said, you just tell us how many pains you want, sleeps, and stress. We make it simple. And we kind of come up with a game plan from there. Just so you know, everybody that's on this phone, on this presentation, we do protect you in some ways. If it was about 90 days later and you're like, Mike, this isn't really working out for us, I'll look at it and go, look, I understand. It's probably, it is what it is, and we'll buy back what you have. I'm not going to put stress on clinics at any level. I want to see this do really well for your practice. We're not here to just put product on the shelf and have it sit. The goal with programs is that it actually gets off the shelf. Okay. And then you kind of order as you need it after you have these kits. You can find out what does well, what doesn't, and you kind of go from there. Those specialty kits that we have, if you want to, you're like, holy cow, I have a lot of sports and athletes. I just want to do that. We have a program that just does that. You actually just send you 4 kits. You could use one for yourself or sell all 4. If you like what's going on, you just order more. And then we send brochures with that. And we actually send a graphic sign. So that's a great way to get started with us too. So simple orders. And that's about it. If you feel like this is definitely not ready at this time, but you're really, really interested then reach out to me and I'll send you out a sample kit. I have a trial that you could do. It's free of charge. I'll send it right out to your practice because you've gone through this with Taylor Medical. This is one of those things we've done with Taylor, is that it's a very step-by-step. You get the basic pain program is what we send out, so you could trial this. It's enough for like 2 to 3 patients, or even yourself and a bunch of staff you want to try to hunt down and start spraying. So we can do all that for you too. But then there's a way to report the results back, and we can review them and see how you did. So this is an option. Figure this is about, it takes about, you can really get some good results in about 4 to 5 days. And this goes out immediately too. So this is another option for you if you're kind of on the fence. But again, if you really believe this would be added value to your practice, reach out to me and I can get you started very, very quickly. So I want to say thanks. I know Doc's going to go through some questions. We're going to open the floor for any questions that you do have. First and foremost, I want to say thank you for all your time. I know it's extremely valuable, and all of you are busy with your practices and, of course, everything that's going on these days. So thank you very, very much for your ears and your time.
Mike, thanks for the presentation. I actually was, I learn things all the time, and, I don't clinically see patients anymore, but when I see the amount of work and effort that your company has done to make this turnkey, even so much as making sure that the credit card fees are not going to tap into what their potential is. I think that you guys have done a lot of work. So I applaud you for the effort that you've done in trying to make this a turnkey operation for our members and for their patients. So,
very much, yeah, thank you.
Everybody keeps hearing things about THC and, and hemp and cannabis, and what's the difference?
So we have everybody, I think, was what we're grown up to hear is the marijuana and cannabis, right? So that's a THC CBD kind of extraction point. Most of it's obviously used for, gummies and chocolates that you're hearing in the market. There is a CBD property to it, so they try to filtrate that out. That's where you kind of get into they do what they call broad spectrum. They kind of filter it all the way down and down and down to try to get the THC out of it. But what the government kind of essentially did was, okay, wait, there's that, and there's another species. Side species is hemp. It's a totally different plant, right? So they said, look, this has the same properties in the cannabinoids, but the THC levels, that's another animal. Plus, we're already using this in industrial fashion already. So they're finding some natural effects from it that are essentially our body makes, right? So the cannabinoids, you're going to find throughout the body. They actually found some studies that it's actually in breast milk, and it's just something that's in our bodies as it is. So it enhances within that. And what they're finding is with hemp is that it's easily to be extracted to get the THC out without a lot more, I guess you would say, worrisome that comes along with it. So in 2018, they separated it out. That's why you're seeing some states like Florida. I'm in Florida. They want you to have a bunch of education, get the licensing, you got to pay like $5,000-$6,000 a year. That's the cannabis side. The hemp CBD side, it's not that what you have to go through. Some of the food regulatories, or if they're making it in foods on site and things like that, they have to pay a yearly license for $600. So you still have to check with your state if they just have small business license for you to carry it. I haven't heard very much from most states. Some have very, very small fees per year, but otherwise it's just easily regulated. So it's easy to ship over state lines. It's easy to offer without worrying about the licensing. So that's really the big difference between the two.
Great. So, it's interesting. You hit on something. I've got a couple of questions. One of our members got on, said he missed the first 15 minutes and wanted to know, is this legal in all 50 states?
Hemp CBD is. So it is legalized in each state. It's the cannabis that's the issue that's coming up. But still check with the regulations in your state. We have no problem shipping to any state. That's not the problem. It just comes as if you can offer it. Now, there is a lot of this is huge. There is a lot of misinformation on the internet about doctors carrying hemp CBD in their practices. There is a website that you'll come across immediately because you'll probably Google, can I carry hemp CBD in my medical practice? And the blog is run by a dispensary. So you can kind of see where that's going. There is no validity to it. You as physicians know you have you really have the guidance of within your practice to do what you believe is right for your patients. This is not a prescription. It's totally federally regulated and legal. So we are not in one space, we're in another. So the hemp CBD is what makes it possible. So
This is a great question that we got from one of our members. How can we help people who have restrictive jobs, i.e., CDL, police, firefighters, military, etc.? Are these products something that they could use, or are they going to test positive? Are they going to have problems at their job?
This is an outstanding question. So let me kind of go back. If I can, will take us probably too long to skip slides, but let's do this. Out of our product line, there are orals and topicals. So we're going to take topicals right off. Topicals on the skin, there's no liver passing. So that's why there's no issues with tox screening. So that just moves us into the orals. So now the orals, we have two different orals that we actually offer. We have our sublinguals, which are by far we would recommend is the best way to take it, and that's what's called full spectrum. And full spectrum is taking the whole leaf, right? All best penance of the leaf, and what comes with that is the THC, but at 0.3% or less. From studies and response back, there's no issues with tox screenings at that level. However, there's still obviously concerns in the market. We totally understand that. So we have provided two other products for physicians to offer to patients: chewables, which are 0% THC guaranteed with isolate. And then our capsules, which are a 50 milligram, also an isolate guaranteed at 0% THC. We've also, with our kits, with those the physical rehab kits and our sports kits, we know, because we're working with some athletes now, actually working with an Olympian, they are worried about tox screening too. So our joint solutions for joint health, that's an oral spray that's in there. It has turmeric. That is also with a certificate guaranteeing at 0.0025%. So it's basically zero. So we have all the certificates to back it up. We just can't give a guarantee on the tox screening because we don't know what else they're doing in their day. So we don't.
Well, and I completely understand. I think that from our perspective as physicians, we just want to make sure that we're not putting our patients in any jeopardy. And I think the other thing is, do these products impede their cognizance? I mean, is it something that your CDL long truck driver, does he we need to advise them when and where to take these medications, because we don't want to cause them to have any decrease cognitive skills.
Yeah, and that's the best thing with when you do the isolates, you're getting the best properties of the actual the CBD itself, not the THC concerns. So that's where the non-intoxication, non-addictive, and then the 0% isolate comes from, and that's the best use for it.
So I've got to. I know this is probably a dumb question, but
never. Never.
Do you get high if you take hemp?
If you, no, there's no intoxication effect, and that's the thing is, like, even what's kind of interesting is that it's fine. You find it interesting when patients report back to some clinical offices the things that they actually do and they shouldn't. So we all could laugh on the things that they try to take on their own. So we've actually had individuals drink the entire bottle of drops. So I would never recommend this, but they don't even get intoxicated from that. So you have to the breakdown, obviously, in the system and metabolizing of that low amount doesn't create intoxication. So no, to get to the straight point, nope, you don't get high. That's what we're working on. Is there's no intoxicating effects, and again, that really can be addressed with the isolate products, so the capsule and the chews.
Great. So I know we talked earlier, just a few minutes ago, about tox screening and with the MedEcho products. You made a comment earlier about you don't know what you can't guarantee them because you don't know what the patients are doing in their private lives other than what they're taking from that they're purchasing from our clinics. But I did want to reinforce you are doing certificates of medical authenticity that document the levels of what's in these products, so that unless it was a malfunctioning in the batch production, the products would not be something that would show up positive on a tox screen, correct?
Yeah, that's correct. And that's why we do the certificates after manufacturing, to ensure quality at that point before bottling. So, and then we do it by batch, so you can verify that batch. And as you know, with tox screening or product screening, they're going to take multiple products from multiple lines of the batch, and then we do a 5-time testing from there.
Okay. what do you think is the biggest challenge to offering MedEcho in the practice? I know that, I saw this question here, and I know that, when I was in practice, there were some things that I just had no problems getting my patients to purchase. Obviously, for me, I had to believe in whatever I was selling in the clinic. But what do you think is the biggest impediment that a doctor would have on introducing this into their practice population?
This, I'm going to say, is one of by far the best questions, because what it comes down to is understanding the product in a simple way. So the hardest thing is that CBD itself starts to come off as it's a very conglomerate thing, right? There's a lot of unknown to it. There's a lot of all over the place direction of how to use it. There's very low guidance. So what it does, it already starts to set the precedence of, I'm going to get a bunch of questions. I don't have time to do this. I need to simplify it. There's going to be way too many what's, whys. Then I got to show them how to use it. That is exactly why we go protocol, because our objective is, we know there's a benefit for doing these things within the medical levels. We're seeing that outcomes and clinical response, but how do we simplify it? And that's what we want to try to do, is for you as a physician or anybody that's on the call, how do we make it easy for you so you can remove all those concerns? And then the information that you're providing is very systematic. It's been vetted out. It's going to get you the best result and just get people started and following the programs. Because what you probably don't want to do is go through the effort of giving them something and then they don't follow through. So we want to see that process all the way to the end. And that's kind of essentially what we've taken off the hands through these programs. So that, coming down to it, is the simplicity of what we're trying to accomplish, is just making it easy. And that's really where it comes down to, is that there's just so much complexity behind it, because you really don't know what product and how much, and do I titrate it? Which one do I give? And what should I mix it with? And that's essentially what we try to get rid of, is all those questions.
That's awesome. When we got started, I was telling you that we do this, it's fairly laid back. I think I've asked all the questions that have come up, and I think you made a great presentation. Before I let everybody go and dismiss the class early, is there anything that you want to say, any closing comments that you have before I make my closing comments?
No, and I first want to say thanks for the time to do this. I know there's always hesitation at every level, especially in medical, to take on new things or look at new things. That's why I think in the end, we want to make it simple for you to at least attempt to do this, see if it is right for your practice, your patients, see the outcomes, see the process, and then make a decision. Yes, this is good for us. No, this is not. And that's what we're guaranteeing, is that we want to make it very simple for you. So our process is to be very staged out. So if you do want to get started with us, just email me and we will get you going. I'll make sure that's out in the email that we do first thing tonight.
Well, I appreciate it, Michael, and thanks for joining us and being a big supporter of the Taylor family. Well, everybody, we're going to let you go 7 minutes early. I appreciate everybody signing in and staying and watching the whole program. Next 2 weeks, on next Taylor Tuesday, will be by Total Ancillary. They're going to be talking about the mechanics on how to manage a good biologics program in your practice. It seems to be a problem that many physicians are encountering in their practices. So, Michael, we'll look forward to getting your emails, and hopefully people will reach out to you, and appreciate all the support that you've done for us. And we'll see you next time. You're on mute.
Thank you. I really appreciate it tonight.
Everybody have a good week. We'll see you in 2 weeks. Thank you very much.
Thanks, Doc.
You're welcome.